Okay.
All right.
All right. So when we know those definitions of trauma, we know what examples of trauma would be, but trauma does not look the same for every person. And I really love this infographic on the screen, because depending on the individual, depending on their identity, depending on their support system, depending on all of these different cofactors or confounding factors, the way that a person experiences trauma is unique to them. And so I'll give you a quick example. It was a few years ago, there was a house fire in a community, and it was a mother and a father and two sons. And the mother, the news clip, they interviewed them after this negative experience took place, and the mother and the father were obviously devastated, right? They lost everything, their tangible items, they were in a financial burden, all of their memories were lost and things like that. So they were visibly upset. They interviewed the two boys, the two young boys, and they said, oh, it was the greatest day ever. We got to ride in the fire trucks. They turned the alarms on. We got to go to the firehouse and put on all the clothes, right? And so same experience for those separate individuals, but vastly different impact, right? And so we have to know that if you have two individuals that go through similar experiences, they may not process that trauma exactly the same, right? Again, that's individual and unique to each person. And here are some symptoms of trauma, some things that we might see due to a person processing trauma. This is not an exhaustive list, so I'm going to put them all up on the screen and just talk about a couple of them. You might have people that experience nightmares or hypervigilance. And when we talk about hypervigilance, that is the thought or the feeling of being constantly on edge, constantly very hyper aware. We have an increase in anxiety. We have an increase in some auditory hallucinations, and these are negative auditory hallucinations. Some people have difficulty problem solving, have difficulty making decisions in everyday life. We have an increased risk for depression and substance use. We also see a strong increase in self-injurious behavior and suicide attempts when we have a negative experience, such as sexual assault or abuse. And we might also see aggression from those folks. We might see people that are angry, that are acting out, that might exhibit behaviors that are outside of the norm for that individual. I want to go into a study that went on in the late 90s by a man named Dr. Vincent Felitti. This is just going to give you a little history of the prevalence of trauma within communities. So Dr. Vince Felitti was a director of a weight loss clinic in the early 80s, mid 80s. And what he saw in his weight loss clinic is he was running a really successful weight loss clinic. However, he saw that after a longevity or a period of 5 years, he saw 50% of his folks drop out, right? And so he got together he found out that almost 300 participants who dropped out of this weight loss study. So he wanted to go and talk to them and say, why was this happening? Right. And so he met with a woman and he interviewed several people, right? Almost 300 people. And he met with a woman that during her weight loss journey, she started at over 400 pounds. She came to this weight loss clinic and was very successful. She got down to around 130 pounds at her lowest weight. She, at 132 pounds, dropped out of this study, came back several weeks later, I think it was almost 2 months, and was back up to 170 pounds. So here's this woman, what she talked to Dr. Felitti about was that at her lowest weight, she was at work one day, and a man came up to her and made a comment, a sexual innuendo to her, and it was unwanted, and it was very triggering for her. So she immediately dropped out of the weight loss study and started gaining back all of that weight. That comment to her, that sexual advance to her when she was at her lowest weight, reminded her of her childhood, where she was sexually assaulted by her father between the ages of 9 and 13. And when she was that young and she was in her early teens, she noticed that she was using food as a way to cope with some of that negative experience that her father was putting her through. And she realized also at a very young age that when she was heavier, at her heaviest as a teenager, her father would stop sexually abusing her. And so in that, she carried that traumatic experience into adulthood. And so when Dr. Vince Felitti found this out, he said, we need to investigate this further. We need to understand how childhood experiences impact things like health, physical health in adulthood. So what he did is that he got with the CDC and he interviewed over 17,000 folks within this wonderful study. They called it the ACE study. And what they did was they measured, they set out surveys and they measured things like childhood sexual assault, domestic violence, divorce, substance use, and all of these different things in the home. And what they came up with is that the impacts of trauma are prevalent. They're cumulative. A lot of these things occur. If one thing occurs, such as sexual assault or physical abuse, there's a higher risk for another adverse childhood experience to exist. They also studied that there were that adverse childhood experiences are related to risky health behaviors in childhood and adolescence. So we know that there's an increased risk for substance use and also high risk sexual behavior later in life. They also know that these unaddressed traumas lead to wide range of health and social problems, right? So things like ADHD, things like asthma, things like cancer, cardiac heart issues, they have an increased risk for those if there's unaddressed childhood experiences. We also know that there was a strong correlation between body weight and obesity with folks that have higher adverse childhood experiences numbers. Again, substance use and also depressive disorders. So if you are a person that has more than 4 adverse childhood experiences as a kiddo, you are 12 times higher, more likely to have a suicide attempt, right? So the study showed that when things happen to us in our life, there are lifelong impacts. And so what I want to do now, again, if you have that piece of paper handy, I want to just go through the questions that the Adverse Childhood Experience Study asked. These are the exact same questions that were asked in the early 90s or the late 90s. So I want you to, if you've experienced one of these things, again, this is not something that we have to share. This is not something that you have to do if you do not want to participate, but I am going to go through these 10 questions. So put a 1 on your paper or in your head. If you had a parent or other adult in the household that often or very often swore at you, insulted you, put you down, or humiliated you. Somebody that acted in a way that made you afraid to be physically hurt. If that's something that you experience, just jot a 1 on your paper. If you had a parent or an adult in your household who would push, grab, slap, or throw something at you, or hit you very hard, that left marks or were injured. If that was an experience that you went through, put a 1. If an adult or a person at least 5 years older than you touched or fondled you in a way, in a sexual way, or attempted to have any type of intercourse with you, place a 1 on your paper. If you often felt no one in your family loved you or thought of you as important or special, or your family didn't look at each other to feel close or support each other, put a 1. If you ever felt that you didn't have enough to eat, wore dirty clothes, or had no one to protect you, or your parents had substance use or were too high to take care of you or wouldn't take you to doctors. Put a 1 down. If your parents were ever separated or divorced, put a 1 down. If you've ever witnessed your mother or stepmother experience domestic violence, meaning she was oftentimes hit, kicked, or beaten repeatedly, or threatened with a weapon. Okay. Did you ever live with anyone who had a problem with alcohol or used any drugs? If so, put a 1 down. If you ever lived with a household member who was mentally ill or depressed, or had one of those household members attempt suicide, put a 1 down. And our last one, did you ever experience a household member who was imprisoned? So if you add up all of those ones or all of those little kind of check marks you put next to that question, that is the number of your, this is called your ACE score. So your score for adverse childhood experiences. And I do not do this activity to scare anyone, or I do not do this activity to kind of to ask anybody to share if they do not want to share. But I do this activity because it does really translate to the amount of people that are in our communities, whatever that community looks like, that have been through negative things. The results of that study show that 66% of those 17,000 people that they interviewed or that they surveyed, 66% of them had at least one of those ACE scores. So if you think about that in the concept of this presentation, 66% of us in this room have been through trauma. And so that's really important to take away, is to understand that the people standing next to us, or the people in front of us, the grocery store, or the people, again, Scott, that are working with you at the pharmacy, there's a large majority of those folks that have experienced something really, really negative in their life. Does anybody want to share how that activity, you don't have to share your ACE score, but share how that activity felt? Or anything that was surprising to you that was on there that was a question? I think some, Mary Ann?
Okay, I'm unmuted. This reminds me, and I will say, I feel very fortunate that I didn't really have to deal with these issues. But when I started meditating with a guidance person years ago, I was surprised how many memories would come up that were so uncomfortable, so stressful, that were, once you get in touch with them, you realize how pervasive they are. They don't go away. They're from your childhood. When you were demeaned, when you were ridiculed, when you were laughed at, when you were scared, the loss of security in various ways stays with you. And even if you're at the museum taking a picture and you're in someone's way and they say to you, hey, you dope, you know, what are you doing here? You just revert to a 5-year-old that's been criticized. And that doesn't really rate as trauma. So if this stuff is with us in this kind of way, my 2 brothers who are in their 60s, they get in an argument over what happened when they were 8 years old and 11 years old. If this is what happens, in a relatively low intensity way, I can't imagine what people that deal with this type of stuff, that really, you're, like you said, you have to go through a lifetime trying to cope with it without any kind of guidance. Yeah, I just, I'm just amazed at this list and putting it all together. So that's it.
Thank you so much for sharing, and thank you for just at various stages just being vulnerable, right, in this space. I think and Marianne, everything you were saying was spot on. Our brains are really awesome things. They do this awesome work, but it also, our brain also holds on to these memories, right? And so they can be triggered at any point, right? Being in the museum, being in the grocery store, or just being present with a smell or a visual that takes us back to those negative experiences, right? And so any of those things can happen at any given time, and that's why we have to we have to understand this in order to interact with folks just on a daily basis. I believe it's Dina has her hand up. Go ahead, Dina.
Hi. So I'm a survivor of abuse, and I was well into my 30s before I really understood why I reacted the way that I did. And I had the good fortune to be at Bucksmont at the most difficult part of my recovery. And it was amazing to be able to say to people, I need you to do this so I feel safe, because there are so many situations where you don't have that, and it's really something how you as the person who even experienced this really have no idea unless you take the time to go, wait a minute, what's going on? And really look at it. And then to have the supportive community with you is also pretty amazing.
Yeah. And Dina, thank you for sharing your story with us. I really appreciate you also, and Marianne, for being vulnerable. But both of you mentioned safety. And I think that that's a really important conversation to have, because safety doesn't look the same for everyone either, right? And it really is a perception. And so what is safe to me, physically, emotionally, spiritually, might be very different from what is safe to a survivor of those negative experiences, or just somebody that might identify in a way that is different or unique. So we have to, again, take all of those things into consideration when we, again, interact with folks. Yeah. Anyone else want to share a little bit about their experience with this survey? Anything that shocked you? Right. So I think the outcome of this survey really brought to light in the 90s that trauma is more prevalent than we think. And that there is trauma, there's the majority of the folks that we interact with as clients, that we interact with on a daily basis, may have had an experience that was negative. However, on the flip side of that, us as people that may be a support system for others, whether that's children, whether that's our neighbor, whether that's our faith-based community, those who support others may also have traumatic experiences in their lives, right? And so majority of folks walking on this planet have been through negative things. And so when we see that information, we really start to understand that we can use this concept of universal precautions in a way that encompasses everybody in a more trauma-informed approach, right? And so we can treat others as if they have been through something traumatic and have been through stress. And we interact with them and we look at that person that they may be affected by that. and they may be impacted by some of those things. And so it really, again, puts our trauma-informed lens on so that we can interact with others in a way that's supportive and helpful. And I want to end, I know that our time, I did want to leave some time up for some conversation at the end, but I wanted to end on some of these things. And Marianne, you had mentioned meditation and mindfulness, and I love that, right? Like, you're speaking my language, but there's some things on the screen that are really helpful in order for us as humans to soothe a little bit, to calm, to recenter, to refocus. Breathing and meditation, guided meditation, are a huge coping skill for our trauma survivors. Breathing and meditation really does ground ourselves. It really brings us back to the present, and it kind of releases some of that negative thought process. Another thing that is up here as well is really kind of discharging those negative experiences through movement. So something as simple as stretching, moving our arms, moving our legs, moving our bodies, and getting some of that negativity out is really, really evident. Well, it's evidence-based that it's helpful, but it's really, really helpful, again, to be one with present, kind of connect us back to our present. It also helps get some of those negative hormones and stressors that flood our body when we go through fight, flight, or freeze mode to kind of come out. There's some other ones up here that I do like to mention. A warm hot shower after a long day, or either just feeling a warm cup of coffee or a cup of tea on our hands can really kind of bring our senses back to that area. Another one is putting a cold face mask or a cold pack over our face. Really does connect us back to ourselves as well. And I want to say, is there anything that helps you folks that when you have a stressful, overwhelming experience or day or moment that helps your body, brain, and soul connect? Music and yoga. Oh, I love music, right? I know that I worked with the female adolescents that have been through traumatic experiences, and their music was such a huge coping skill for that population, and super, super helpful. I love yoga, right? I love that we can, again, discharge some of those negative emotions with movement. Yeah. Lori says her cat in her lap, right? Again, another evidence-based strategy. They talk about animals and pets lowering blood pressure, helping regulate breathing. There is some evidence to say that animals do have a positive impact on our physical health and also our mental health as well. Yeah. Reading is a good one. Yeah. Absolutely. So I do want to leave it here and just kind of, oh, Melissa is doing some exercise, dancing. Yeah, love it. I do want to leave it here, and I do want to open it up just so I can see everybody's screen. And just, I know that a lot of the stuff that we talked about in the last 20 minutes or so was super heavy and might be hard to digest. So I just want to see how everyone's doing and what everyone is, what the takeaway was from our conversations tonight.
The reason that I jumped onto this tonight is because I think as a community, it's important for us to be aware of other people's, what other people bring when they enter the community. And so being mindful of things like how you address someone, how close you get to someone, whether or not, do you, as a kind gesture, put your hand on their shoulder when maybe you shouldn't, things like that. So for me, I think it's an important conversation to have as part of this community, so that when we have people come in that we don't know, that we can, be mindful. having that, the trauma informed aspect is coming into something, just being aware and bringing that awareness to how you approach people, not, certainly new people you don't know. But I mean, I have to this day, there is someone at Bucksbaum who specifically asks me first before he'll give me a hug, because he knows my history, and we've known each other for 25 years. But he still has that awareness and that mindfulness to ask permission. So for me, that's why I'm here, because to have that conversation relative to what we as a community can bring to trauma awareness.
I love that. And I think that goes back to what you were talking about earlier with safety, right? And it goes back to having that trauma lens on, and knowing that each individual's experience and life experiences are different. And so we have to be mindful of what people may possibly have gone through. And being trauma informed is really, it's this concept, right? And I think we're in the mental health and social services field, I think it's like a catchphrase now, right? And so it's great to understand these concepts, but what's even better, Dina, which you had mentioned, is to take those concepts and put them into practice. That's the important part about understanding trauma, is that we do those things. Like, we ask people for, can I give you a hug? Can I show you support? We bring that lens into even our interactions with them on a daily basis. And I love that you had mentioned your community as a whole, because when we talk about communities, it can be any type of community. It can be a workplace, it could be a faith-based organization, it can be our families, our family dynamics, it can be our relationships, our individual or personal relationships, right? So communities can look different. Yeah. Anyone else? Some takeaways from tonight?
I have a question.
Rosemary?
Okay, so how do you recognize, or is there a way to recognize signs that someone has suffered trauma? Is that possible? Because, for example, I don't know Dina well, but I know her well enough to, and been in her company enough, I would never have thought she had suffered trauma. And so how do you recognize that in another?
So I think that's tough. And I think that we can, when we talk about post-traumatic stress disorder, which is, a specific diagnosis, they say that symptoms translate over 60,000 different ways. So what one person experiences and their outward signs of trauma might be very, very different from another person sitting directly next to them, right? And so I think that's the difficult part. And I think that that's why we treat everyone as if they've all been through traumatic experiences. We treat them with kindness, with compassion, with empathy, with those acknowledgement that we're all human beings on this planet, right? And so I think that's a really good question, Rosemary. I think that it's difficult. People process negative experiences very differently. Did I answer your question? Go ahead, Scott.
Oh, no, I was waiting for Rosemary to answer. If you do suspect that maybe someone has trauma, are there ways to approach it, like phrases, or, I mean, I know we have to act compassionately, but do you have any tips on good practices on approaching it? I guess one of them's listening, but do you have any other insights or ideas?
Yeah, I would just be as supportive as you can for that person in that moment. If they're going through some sort of trauma symptom, validate their feelings. Hey, I know this must be tough for you, or if you're going through anything, I'm always here, right? And then we can kind of leave it at that and just make sure that they know that your community is a safe community, and make sure that your communities are safe, right?
I think you have confirmed. I've always suspected that trauma runs on a spectrum, and I think your talk tonight talks about that with all the different questions in the ACE study. When we think of trauma, we think of the worst case scenario, but there's a lot of other traumatic things that occur. I know that I went through a large part of my life assuming that everybody was normal inside. So when they acted in a way that I didn't understand, my first reaction was usually defensive or negative. And what this kind of awareness kind of tells you is you have to stop and go, wait a second, this person might have been through a difficult situation that you're not aware of, and to basically back off that reaction that you have.
Yeah, and that's tough. It's difficult too, because we are also humans, right? And so, and we also might have been through experiences. So when we need those constant reminders, right? From especially in a stressful time that we've been going through for the past 2 years, is we need those reminders to give some people some compassion, give some people some empathy too.
No, I'm not frozen.
On my screen, we were.
I'm not on mine.
Oh,
I'm just kind of curious, and obviously nobody needs to
I lost it.
respond to this. Did anybody have a 0 on that? On that ACE score? Did anyone score a 0?
I bet not, just saying.
That's why I'm asking.
And I think that goes back to statistics, and what the original study showed, that there's a large majority of people that have at least one, a large majority. And when you think of your community at Bucksmont, just take a look around. I don't know if you're meeting in person at all for services, but take a look around at the folks that surround you in this community, and really understand that we've all had different life experiences, and that means that we need to exude kindness to everybody.
What's that quote about? Always assume that the person you meet has been through some, I forget what it is, but does anybody know what I'm talking about? Something like, just like always be aware that the person you're interacting with may have had some difficulty you don't know about. I can't remember exactly how it goes, but it's along that same kind of line, because you don't know, and it's the same, I think, in my opinion, the same kind of awareness that we bring to the aspect of I guess acceptance and respectfulness for any kind of a choice, right? If it's something that someone is choosing, you don't know their story, and you have no idea. But I think, going back to what Scott was saying, it is hard, if somebody's acting a little bit standoffish or seems uncomfortable, then we as human beings react uncomfortably as well. We're like, our first reaction is, what's their problem? But if we're being reflective, we might also say something like, am I doing something? Is there something I've done that has affected them in some way? So it is a constant. I just think it's a constant state of awareness and thoughtfulness.
Yeah, absolutely. And just putting on a different lens, really looking at it from a different perspective, and challenging ourselves to look at it from a different perspective is the hard part, right? Because we oftentimes forget, or don't want to, or whatever the case may be, self-reflect. That we might play a role in some of that.
Just wanted to add that, I had some similar experiences working in a work environment in a department. And what often happens is that, if somebody doesn't fit in, or if they react in a way that confuses people, people tend to gang up on them and, share amongst themselves, well, what's her problem, and, why does she act like that? And isn't she weird, sort of thing. And I had someone who reported to me who unfortunately was kind of the focus of some of that. And she had obviously been through some kind of trauma. I mean, it was obvious to me, but it wasn't obvious to the rest of the department, unfortunately. And she had a very difficult time. And, people can be kind as long as you're exactly like them. If you are different from them, they're often not kind.
Yeah.
I like that. I really do. Because it's true.
And I think it's there's a certain amount of uncomfortableness that we have to go through in order to be self-aware. And I always say, get comfortable being uncomfortable, right? Because sometimes we have to be uncomfortable with people to grow and to find compassion and in order to support somebody that's going through these experiences.
Mm.
Thank you, Melissa, for sharing.
Mm-hmm.
Scott, I don't want to take up the rest of your time, and I want to be cognizant of.
No, you're the star. We're here to hear what you have to say.
I want to be cognizant of everybody else's Sunday night as well as we prep for some snow tomorrow.
Yeah. But no, I mean, I just want them to ask, when people ask their questions. And the whole thing is you brought out an interesting point. 66% of people have at least one experience that may lead to trauma. And that's a lot of people. That's 2/3 of the people we deal with. And I know for the largest part of my life, I was just not aware of that factor. I mean, I wish I would have been made aware in my younger days.
Yeah.
And especially if you try to be a people helper, whether professionally or through your fellowship, you're going to run into people that probably have been through some form of trauma. And you need to start, as you would say, learning to be self-reflective and learning how to react to it, not do the knee-jerk defensive reaction. And well, that's why I wanted you to talk, because when we went through that training, I was just like, wow, I just was amazed at how many potential situations for trauma there is, and how it can really impact on people's lives.
Yeah.
And the other part that I know you didn't go into, and I've started reading that book that you felt so strongly about, is that a lot of times what he said is people will put it back in their subconscious, but it doesn't really go away unless you've gone through some ways of processing it and dealing with it. So a lot of times it you think you have it dealt with, but then it rears its head and bites you in the butt.
Yeah. Yeah, and I think Mary Ann had mentioned it earlier when we talked about how our brain is this really awesome thing. Our brain has different components to it, and one of those components to it, I call it the filing cabinet of feelings, right? And so we don't know when we're going to have to look into that filing cabinet and say, oh, this is safe, or oh, this does not feel safe to me, right? Our brain remembers that years and years and years later. And so those experiences come up at the grocery store, at the pharmacy, at church, or wherever we feel safe or unsafe. And so our body hangs on to that.
Yeah, that's the part that amazed me in reading the book, and how it would come back in some people in many different ways.
Yeah. Well, thank you for sharing your space with me. Lori, did you want to add anything? I think you just unmuted.
My way of coping is through humor. So what I was going to say was, and some people are just a-holes.
Go Spoken so true, right?
But thank
And-
you. Thank you very, very much, Jamie. Thank you
Yeah, no problem.
for the video that you did, which looked professional.
So it wasn't me that did that. That was a video that we use for our, every April, we have a candlelight tribute for our survivors. And that was used in our last candlelight tribute. So it was professionally done. I can't take credit for it, but it's beautiful and it really gets our point across and your message from hope. That's a lot of our mission at Nova.
Well, Scott was right. This was a very necessary thing, and I think at some point probably should be done again.
Yeah, absolutely. You just let us know.
Yeah. I was, yeah, Jamie, I'm amazed just what you guys have to deal with. And my eyes were open as a volunteer to some of the problems that are laid at your doorstep and some of the things that people have gone through. I'm glad there's a place like Nova, and just keep that in mind. Eventually, trying to build a page in a directory. And Nova will be on it, a number of other things, but remember that people, and if they don't live in Bucks County, there's usually something like a Nova in another county.
Every
But
county in the
people
state.
can reach out. What's that?
Every county in the state has a crime victim agency.
And
Every single
also,
county.
and this is one thing I didn't realize, you don't need a police report. In other words, you correct me, Jamie, or clarify, but if it's sexual abuse or child abuse or something along that line, I mean, you don't have to produce a police report to reach out to Nova.
Correct. And you
So-
can contact us 24 hours a day. If you know somebody that's been a victim of a crime that lives in Bucks County, our hotline number is on our website at novabucks.org.
Yes.
Jamie, could you share your slides with us?
Sure.
Send us your slides. That would be
Sure,
great, because
yeah.
I'd like to post some of them.
Yes, I can send them to Scott's email. I'll just put them in a
Okay.
PDF form and you can utilize them. Yeah.
Great, thank you.
Mhm.
Don't forget to shop at the Nova Thrift Shop.
Oh, thank you. Thank you. It is right on 313. If you're coming towards Doylestown, it's on the right-hand side. All of our proceeds that go to the Nova, that go through Nova Thrift Shop, supports our Nova prevention programs, which is the program that we are running tonight. So we also run all of these prevention programs in our schools from as young as age 4 in preschool up to 12th grade. How to prevent crime, how to be cognizant of sexual assault, all of this stuff.
Also, I wanted to point out in the training that if you know someone that is a victim of domestic abuse, you can call Nova, but they will refer you to a woman's place, correct? You guys
Yeah.
deal with all kinds of crimes, but domestic abuse, you have a sister organization that people can reach out to. Yes.
So we are comprehensive crimes victim support, except for domestic violence. Domestic violence, we are fortunate enough in Bucks County to have a specific organization that deals with domestic violence. If it is domestic violence and sexual assault related, Nova will take that client.
Yeah, and the other thing I've learned through the training was that even if you're not sure, if you reach out to Nova, somebody will refer you to the right organization that will help you. So that's another thing.
Yeah.
Well, Jamie, thank you so much. We'll let people get on with their lives. Thanks everybody for coming. I just think it's important to be aware of this and to be aware of the people we're dealing with, that they may have gone through something that we don't know about. So
Yeah. And faith, I know we didn't mention it, but faith is a really good coping skill as well. And so a lot of our survivors use faith as a way to process their trauma as well.
thank you so much, Jamie.
Thanks, Jamie.
Thank
Thank
you.
you.
Thanks
Thank
very
you.
much.
Be safe.